We have always our eyes on the long term. One of the big diseases we declared war on is cancer, which is a hidden pandemic with much more impact on global health than COVID. And here we are making big progress. We had a strong first quarter with Bernd, the company we combined with, so to say, and this is a strong innovation focus for the years to come.
Bernd, it's Karen jumping in. I want to ask you a little bit further about that 700 million euros that you're forecasting in revenue from the antigen test, because I think it's fascinating. We've had Omicron, obviously, that has come into the mix in this quarter, and there's been all sorts of government advice about using these testing kits to allow early release from the home so people are not isolating for as long as they may have to in the past. What is the outlook looking like then once we get through Omicron? Is there any way of judging whether we're going to be using these tests as much as we are now, whether there's another variant around the corner? I mean, how do you have any models predicting what comes next?
Well, I wished I would be the only guy on the planet who is able to predict this, But my assumption really is that step by step this will decrease, and that we will not need these tests anymore. Whether there's one more wave to come or not is another question. But I'm very sure that this is the last fiscal year or the last year where these type of tests play a significant role for mankind.
Can we talk about short term then? Because I know a lot of governments are relying on the use of this across populations, but some populations cannot access enough of these test kits to make any real difference. What's the stockpile looking like at this stage in terms of various parts of the world? Are you seeing a rush to try and get a big stash of these particular testing kits from some jurisdictions versus others?
See, certainly the Omicron wave has been a surprise for mankind and for many countries, and this triggered a moment where there was definitely a demand peak. We did our best, and we are doing our best to fulfill this extra demand. Not only in Europe, but now with a particular focus on the United States. But I think we are getting our arms around it and are able to fulfill the demand. It's a balancing act, but we are getting there.